Hello guys, I came across a video of this lovely looking lady who deserves a chance at happiness in life, but because of negligence and carelessness, she is forced to live with this health condition for the rest of her life. I'd like us to take a look at this video and then we will talk afterwards.
I was never born this way. Yeah. Never.
Tell us about it.
It was just Johnson and the doctor carelessness because this thing happened to my sister, my brother, but they noticed their own on time, but they not noticed my own on time. When my daddy is telling them that check me, but they do not listen to my daddy, and after 5 days later my body changed.
Hi everyone, my name is Dr. Bill, the health talker, and you're welcome to the fertility and IVF series. Today we'll be having a very important conversation on the topic cerebral palsy. But before we go on, I must say it is demeaning to use the term imbecile on any child or adult facing this particular health challenge, or to label anybody with any health condition that you know of as a result of you wanting to mock them or wanting to hurt them. The reason is because there are several factors that's beyond their control that could have been responsible for these health conditions that they had no role to play. Some of the factors for this condition could have been before they were born, or just a minor mistake or overlook or oversight from the doctors caring for them or from their mothers as a result of inexperience, or just their environment, or some kind of infection from anywhere. Please do not take lightly someone else's condition and then mock them in the process. That being said, let's talk about cerebral palsy. Cerebral palsy is actually a group of non-progressive, permanent disorder in movement and in posture that happens to an individual or a child as a result of damage to the motor control centers in the brain. And some of these causes could occur when the child is still in the mother's womb, could occur during labor, could occur when the child is just delivered, could occur even when the child goes on to become 1 or 2 months. Some of these factors that we will discuss, like I said, but the bottom line is sheer negligence and carelessness, either from the mother or from the care attendants. And when I say care attendants, I mean both the doctors attending to the pregnant lady, the nurses, and if she chooses to go to a traditional birth attendant. Carelessness and negligence are some of the known factors that we have seen repeatedly to have been responsible for cerebral palsy. Okay, it will also interest you to know that the majority of the causes of cerebral palsy occurs during delivery or after birth. There are some cases where we have a child being born already with a lot of signs and symptoms that has already affected the brain development. Okay, but we're seeing increasingly that cerebral palsy is more common during delivery. What does this tell us? It means that never assume that you're too confident in taking delivery, or that you know that you trust a traditional birth attendant's skill or a midwife skill too much compared to taking a woman to the hospital for proper monitoring and delivery. Don't assume that because you have been pregnant for the first or the second child, and so you know that this one everything will go on smoothly, that you forget to register for antenatal, that you forget to take your proper medication, that you forget to ask your doctor for a proper prescription and to explain every medication that you're taking. As we will see, the causes of cerebral palsy. Palsy has been known to occur during pregnancy. Issues like diabetes, thyroid problems, malnutrition, infection, incompetent cervix, and antepartum hemorrhages, genetic issues, some drug, as well as premature birth can cause a child to have jaundice. It has also been known that during labor and delivery, premature delivery, prolonged rupture of membranes, fetal heart rate, long labor, women in antihypertensive treatments or preeclampsia, as well as long labor and asphyxia, these are some of the major things that can cause cerebral palsy, which is why we keep saying when a woman is pregnant, it is the best option to go to the hospital so that doctors can know, after checking and doing thorough examinations, to know if there are comorbidities for her to treat, like diabetes or thyroid problem, or check her weight and check other vitals to know whether she's malnourished so that they can treat this child. Okay, during antenatal care, there are some ladies that are placed on BP medications to manage their blood pressure. Medications like magnesium sulfate has been known to cause jaundice. Jaundice, like we say, is the major predisposing factor for cerebral palsy. Uncontrolled, severe jaundice that are poorly managed. A lot of antibiotics is not good for every pregnant woman, which is why it is not the best time for you to go to the chemist or even the midwife to manage you. Some medication, even down to steroids or anti-malaria in your third trimester, can cause a child to develop jaundice. And a jaundice, if left untreated, can cross into the blood-brain barrier and cause a child to have cerebral palsy. Which is why every medication you take as a pregnant woman, you must ask the doctor what is the detriment of this medication on your unborn baby's health. If this medication has any slight possible harm, they will let you know to discourage you. Even down to excess intake of paracetamol is not advised as a pregnant woman. There are other things like infection, sepsis, brain bleeding, low birth weight that can also cause a child to have cerebral palsy. You're a lady, you're a mother, you're giving your child to a 3-year or 5-year-old to carry. If that child falls and hits the head on the ground, the child is exposed to brain injury or even stroke or traumatic brain injury, like we said. And this child can have meningitis or encephalitis and bleed into the brain and develop cerebral palsy in the future. Okay, like I said, the main reason that we are battling with this cerebral palsy and is increasing in this generation is as a result of carelessness and negligence. Please pay attention to your child's birth weight. Don't assume the child will pick up. Your child is not growing when it's supposed to grow. Your child is not gaining neck control. A lot of things can cause cerebral palsy. Cerebral palsy, like I said, can be caused when the woman is pregnant. How do we know? A woman that is pregnant, for example, can have infections, fever. I must say, not every fever is malaria. Please don't go taking malaria medication simply because you are pregnant or you have fever. That fever could just be a very big sign telling you something is going on with your system and is going to potentially affect your baby inside your womb. What should you do? Go to the hospital, not the chemist, not the midwife, not the traditional birth attendant, a hospital, which is why you'll have to register early. Febrile convulsions or febrile issues that we mistake for malaria affecting the pregnant woman could be a major sign that could affect the child and cause cerebral palsy. Issues like diabetes, issues like hypertension, issues like malnutrition, and some other issues I will list on this video that you will see that could be potential causes of cerebral palsy. Secondly, other causes of cerebral palsy could happen when a woman is about to deliver. There is a lot of misconception that a woman who is under labor for 2 or 3 days is normal. Please, I have to make that correction. Any labor that is beyond 12 hours is already too long, because you as a lady can survive that labor because your pelvis, you're already used to adjusting and enduring pain, but the brain of that child you're about to deliver can go through so much stress within just a short period, that stress leaves a permanent damage. Like I said, cerebral palsy is a group of non-progressive but permanent damage to the control, damage to the brain, such that a control of motor system and function and even speech and coordination becomes affected. So imagine a baby's head stuck into a woman's pelvis for hours and for days. Don't say my auntie was in labor for 3 days, nothing happened to the child. My sister was in labor for 2 days, nothing happened to the child. So I can be in labor for 24 hours and nothing will happen to my child in Jesus' name. No, don't take that risk. Once you are in labor, go to the hospital and be checked by a doctor. That being said, there are some other conditions like fever. As simple as a fever can affect a child. It can lead to cerebral palsy. Meningitis, for example, can cause cerebral palsy. Don't assume it to be malaria. Don't assume it to be something else. Take the child to the hospital. These are early things that we could avoid. It's part of the negligence and the carelessness, either from the mother's side or from the care attendant's side. Once you are treating a child for fever for more than 2 or 3 days and you notice the child is not picking up, take the child to the hospital immediately. You are breastfeeding a child, your child is always crying and is always anxious and angry, doesn't suck well. These are signs to take the child to the hospital, because there are so many things that happens that a child cannot speak. Because of the fact that the child cannot speak, there's so many symptoms that they want to complain but they cannot complain. More reason why your doctor should be the best friend you have when you're pregnant or you're in labor and you just delivered, until your child gets to 2 to 3 years and you know that there are no issues, the child is growing very well. These are times to relax. Your child is supposed to crawl at so months, it's not crawling or she's not crawling. That's a cause. It's a cause for alarm. Your child is supposed to be walking and it's not walking as I went due. That's a cause for alarm. Raise the alarm on time and take the child to see a doctor. As you will recall from this video we just watched, you will never be able to miss signs of cerebral palsy or abnormality in control in your child when the child is little. A child as at 8 months or probably 1 year still not gain control over head movement, or is always flexed or extended in such a particular way. Don't assume that the child will grow out of it. Take the child to see the doctor for a proper examination. During a proper examination at birth, the doctors will have a particular way of checking whether this child's motor function is proper. They're called the Moro reflex. At delivery, a child cries and extends and contracts. There are certain movements the child gives to let you know this child is very okay for the age. There are certain signs as well that this child, certain type of cries or loud cries or inaudible cries or particular features that this child gives at birth that makes you know you have to keep a close watch over this child. From the video we just also saw, we could tell that cerebral palsy can literally affect every part of the body, to the speech, the concentration, the intelligence, the motor function and control, eating, and also cause regular frequent convulsion if care is not taken and if a child is not monitored. And a child almost becomes a vegetable, in a vegetative state. So even when you notice that these signs are starting to occur in your children or in your child, take the child to the hospital. Let them suggest a proper way of management. Early physiotherapy and early cognitive therapies can help this child grow and make this child useful in the future. We've had a lot of celebrities even that had noticed that the child had cerebral palsy that affected. Well, once your child is affected, it affects you, the parents, because you have to keep a close monitor for that child, which is one reason why you must make sure that the child gets every necessary attendance at birth. Oh, doctor, my child is not crying the way he's supposed to cry. I don't like the sound of that cry. Is it normal? You are free to ask, inquire as a mother. Don't assume because you've had 1 child or 2 children that you know everything about upbringing of children. Don't assume that. Always consult the doctor, not the traditional birth attendant, not the chemist, not the midwife. I beg you. There are a lot of medical conditions that we could avoid if only parents learn to open their mouth on time and talk to the doctors about their child's signs and attributes that they see. They ignore these things, and at the end of the day, because the children cannot speak, it leaves a permanent damage to these children. Cerebral palsy has different types. Cerebral palsy can affect just one hand and one leg for that child, can affect the two legs. There are medical terms for it, but I will not bother you. I'll leave the names on this video. Okay, the cerebral palsy can affect a child's two hands and two legs. Cerebral palsy can also affect a child's neck and paralyze every part of the body, such that you have to literally feed the child and do everything for the child. But with early physiotherapy, with early consultation and early behavioral therapy, the child can improve with time. Nigeria is still growing in terms of therapy for some of these congenital problems or childhood birth problems. So over time, we're still looking forward to behavioral and cognitive therapies facilities where children can undergo a lot of these sessions and become better. But for now, please protect your child. Once you notice you are pregnant, register in a hospital. Now, Jesus. Once again, my name is Dr. Bill, the Health Talker, and this is the Fertility and the IVF series. Please like, share, comment, and follow this page for more exciting topics. Have a beautiful day.